And then next, I'd like to just introduce John Duke, who is the Director of Clinic and Health Services at Outside In, which is a local federally qualified health center here in downtown Portland. John has his master's in business administration from the University of Oregon and serves on the board of directors of both the Coalition of Community Health Clinics and the Oregon Primary Care Association.
Another group that we serve at Outside In, we have a syringe exchange for people who are injection drug users. There's about 3,000 of them we serve a year. These folks are largely homeless, low income, largely beneath the poverty level. They also will qualify for Medicaid. Right now, a person who is addicted and does not have insurance does not have access to treatment. There's a huge demand for treatment, and in our enrollment efforts, we have been very, very successful in getting people at our syringe exchange to sign up. They want to get treatment, and that will change the world for them too. No longer will they have to camp out for a week trying to get into Hooper Detox, having to show up every morning at 5 in the morning to get the slot that is available and finally get into detox. They can make an appointment and check themselves into Providence tonight and get into treatment there. We're looking at what does that mean when all of these folks who were formerly uninsured are now insured. Can the system handle it? Well, it's going to have to grow. It doesn't have the capacity yet to serve them. So we're going to be looking at a period of time when, though people may have coverage, there may not be sufficient access. And the services that were designed before were not designed for them. They were designed for a different population that did have insurance. And so now you have this new population that has different characteristics, and the treatment will have to be adapted to serve this population better. One of the greatest things, the thing I think is most wonderful for the clients that we serve, is now that they have insurance, instead of becoming the people that are cast out of systems that don't want to see them, they will become consumers with consumer power. They can choose who they want to go see, and if the person that wants their money doesn't provide what they want, then they can go to someone else. They have that consumer power, and that for them is profoundly healthy. So I'll leave it there. So, big demand. The first day that, on October 1st, we had 2 people show up when we opened our doors waiting to get enrolled. Of course, the portal wasn't open and there was some confusion, but the demand has been high. We so far have enrolled 450 people in Medicaid, about. We're enrolling about 10 a day. And I know that all the other health centers that we are partners with throughout the whole state, but certainly in the Portland area, are also actively enrolling and having the same sort of demand.